This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Great. Thank you so much, Kathy. And thanks to PM&R Scholars for putting this on. We're so excited to be here. It's the kickoff of another interview season. That's why we're excited. My name is Monica Rowe. I'm the Residency Program Director at Northwestern University, Feinberg School of Medicine. So the first thing you have to know about us is, first of all, like our name is there's a lot of names for us. So we are McGaw Medical Center. So if you are looking for us and you're interested in applying to our program, you actually have to find us by searching McGaw Medical Center, because that's the medical center, that's the GME center for all of Northwestern. Some of you guys may have also heard of us as the Shirley Ryan AbilityLab. Others, like old school, have heard of us as RIC, but we are Northwestern University. We're part of the Feinberg School of Medicine there. I do have a bunch of people with me today, so they are going to do most of the talking, because honestly, I don't know that a lot of people want you to hear me talk for the entire 20 minutes, but we're really excited to have you guys all here. Usually on these open houses, we usually go around and introduce everyone so that we can meet you, but I cannot believe there's like 60 of you guys on here. So kudos to you guys for all showing up. Maybe instead of like going around and introducing, meeting everyone, maybe if we can have like a quick little competition of who's got the best background. So if like people want to turn their cameras on and like, let's just like peruse, like who's like on a beach? Is there someone I mean, it's like Sunday, you're not supposed to be in a hospital, but is anyone in a really cool location that's willing to share it? Oh, blank wall. Oh, someone's got a good virtual background. I see, here we go. Look at that. Ryan Mortman's got some, what is that in the background, Ryan? Which city?
That is Chicago.
Oh, it's Chicago. There you go. All right. So some blank wall. It's okay if you're in a blank wall too. That's perfectly acceptable. If you have a nice frame picture there, that's totally fine too. But thanks for kind of jumping on, and so it's kind of fun to see everyone's faces too. So feel free to stay on and so we can see your faces. But I also understand if you guys want to turn your Zoom camera off. We don't have prepared slides. Like the point of what we're trying to do today is we want you to get to know our program. And I'm going to tell you, I'll put a link into our website. If you want to know the actual nitty-gritty details of our program, you can go to our website and kind of see how much call you have and see all the different rotations. What we want to try to convey to you today is what it's like to be a resident in our program. And I'll tell you, we are one of the largest PM&R residency programs in the country. For those of you who don't know, the Shirley Ryan AbilityLab is a standalone freestanding rehabilitation hospital. It is actually one of the largest standalone rehabilitation hospitals in this country as well. And so as a result, we see kind of a wide variety of all different types of rehabilitation patients. We will see the sickest of the sick. So this program is really intended for someone who really wants broad-based comprehensive training within PM&R. And essentially what we're trying to do is we try to tailor different things for our residents to allow them to grow into the physiatrist that they want to be. So a lot of you guys may be attracted to our field because it is so broad. And so there's so many different venues that you can you can go down in order to become a physiatrist. And what's really cool about our program is that we give everyone basic broad-based training in PM&R, but then if you are interested in pediatric rehabilitation, then your residency program should look different than someone interested in cancer rehabilitation, or someone interested in sports medicine, or someone interested in pain, or someone interested in medically medically acute complex rehabilitation. So our training facilities basically allow our residents to do that because we do have broad-based exposure to a lot of different things. So I brought along some friends. Our chief residents are actually here joining us. So I'm going to actually turn it over to them, and each of them are going to talk about a little bit a topic, and then we will give some time at the end to answer your questions about the program. But again, it's really exciting to kick off the year, the recruitment year with you guys, because it's always fun to see what new physiatrists are going to be entering our field. So it is pretty exciting. So thanks again for all of you guys taking out time out of your Sunday evening to join us. So who's next? Is it Alice or Chris? Can't remember.
It's
Alice.
me.
All right. Yeah.
Thank you, Dr. Rowe, and it's really nice to see everybody over here. I'll tell you a little bit about myself first before I go into my assigned topic. I'm one of the PGY4 residents and the administrative chief over at Shirley Ryan / Northwestern. I did my medical schooling initially at University of Iowa, then I transferred over to Loyola University in Chicago. And then I did my intern year, a medicine year, in a small safety net community hospital called West Suburban, which I chose very intentionally because I'm really interested in serving an underserved patient population. And then I went into PM&R specifically because of its focus, like Dr. Rowan mentioned already, on really building these relationships with patients, on improving their quality of life, despite perhaps their very complicated, complex medical histories, like a brain injury or a complex amputation. And I think it's really rewarding to apply that medical knowledge and work closely with therapists, especially very experienced therapists here over at Shirley Ryan, to see patients regain their function, both on inpatient and outpatient levels. For me personally, my interest is severe chronic pain and women's health rehabilitation. I think it offers a really complicated, those interests really fulfill my interest in seeing complicated patients and helping them fully recover as much as possible. I think, like Dr. Rowe mentioned as well too, I chose Shirley Ryan because I have the opportunity to both build my basic knowledge and also really focus and hone in on my clinical expertise. So in fact, I'm currently on elective right now, so I get to do a mix of whatever I choose to do. We have 5 months, 6 months of elective. And right now, like on Mondays, I see women's health rehab cases. And tomorrow I'm going to be doing a trigger point injection for the pelvic floor. And then on Wednesdays, I actually go in neurosurgery clinic to see spinal cord stimulator cases, to see patients assessed for that. A little bit about Shirley Ryan from a DEI perspective, or diversity, equity, and inclusion, is that we have a really truly inclusive community with a lot of people with diverse interests. And we're really trying to build that outside of Shirley Ryan to address other, underserved patient populations. So Julia and I actually coordinate a monthly musculoskeletal community clinic over with one of the largest nonprofits for community-based care in Chicago, where we work with the sports medicine fellows very closely and offer patients appointments on a monthly basis to assess them, and also offer them orthotics, physical training exercises, education, pamphlets as well too. We also have a fairly robust and growing curriculum for DEI too, where we talk about, implicit bias within our medical model itself, talk about healthcare access and equities, and then also diversity within the field of PM&R itself. And we're really excited to keep working, building up those opportunities. With that said, I'm going to pass the baton on to Chris Lewis.
Thanks, Alice. My name is Chris Lewis. I am one of the PGY4 residents and the academic chief resident this coming year. I grew up in Seattle, Washington, and went to University of Washington School of Medicine for my medical training, and then came out to Chicago for my intern year and now for my PM&R trainings. One of the reasons I was interested, I piggybacking kind of off what Alice was saying, really like the multidisciplinary aspects of PM&R were really attractive to me. I feel like I got to really interact with a lot of different specialties, as well as the team that I worked with every day was really large, whether it's physical therapy, occupational therapy, nursing, social work. You really get to meet so many different people. My personal interests are in cancer rehabilitation and clinical informatics. And so that's looking at applying into this application cycle for fellowship. One of the things I wanted to highlight is kind of what we offer for research here at the Shirley Ryan AbilityLab and at Northwestern. So overall, I think the research support for residents is one of the many strengths of the program. And because of the breadth of opportunities that we have, you're really able to match your clinical interests with the research projects you're able to carry out. So just to name a few of the ample opportunities, there's opportunities to get involved in medical education, quality improvement, diversity, equity, inclusion, like Alice was talking about, as well as really any of the clinical subspecialties in PM&R. First, another thing I wanted to highlight really was how we offer mentorship for our residents. So we have, when you start as a resident here, you get assigned and paired with two mentors. So one really partners with you for your research projects, and the other one more clinically and for career development. So from the get-go, you're really partnered with somebody to help you navigate the resources that we have, as well as, you know, pair you up with someone who can connect or based on your clinical interests. Second, I really wanted to highlight the support we give our residents for their research. So like Alice was saying, we have elective time that you can take to do research. Additionally, if you have your research accepted to any national conferences or anything, you do get financial support for traveling to those conferences, as well as time to take to go to those conferences. Third, we also have an extensive didactic curriculum that covers every subspecialty of PM&R. One of the things that we also include in that is training on how to conduct research. So there's a specific research curriculum where there's topics such as, you know, how to write an abstract, how to ask a research question, how to conduct like some common statistical analyses. So I think really the takeaway here for to think about is, you know, whether you anticipate research being an integral part of your career or something that is really a highlight, you'll find the support and opportunities that I think match your interests and your goals at the Shirley Ryan AbilityLab. So happy to answer any more questions if people have those at the end, but I wanted to pass it off to Kara Vernakia to talk about our next topic.
Hi, everyone. I'm Kara Vernakia. I'm one of the PGY4s at Shirley Ryan, and I'm also the recruitment chief. I'm so excited to see so many of you on here tonight and looking forward to meeting you as the interview season rolls. So I chose Shirley Ryan for a couple of reasons, but one of the main reason was because of our robust pediatric exposure. We do have an inpatient unit that has about 20 patients there at a given time. So it is a lot of pediatric exposure. So if you're interested in peds, then that would be one reason to look at our program for sure. And then the other reason was because of our interesting tracks. So through Northwestern, there are a couple different tracks, including a 5-year research track where you do an additional year of research. There's health equity and advocacy. There's a leadership track. Where they can train you to become a medical director, program director, section chief. There's also a global health track, bioethics, and then there's also a medical education track. And through Shirley Ryan, there are 2 different tracks, including a medical education track and a quality improvement track. So I'm actually part of the medical education track, which has been incredibly rewarding. We meet it's just one day every month for about an hour. And we talk about topics such as how to both give and receive quality feedback, how to write a good board question, how to incorporate diversity, equity, and inclusion into your practice and education for medical students. And so it's been a really rewarding experience, and we all come up with a project for the end of it. So I'll pass it along to Julia.
Hey everyone, my name is Julia. I am the Resident Affairs Chief for this year. I'm originally from Boston, and I have just really loved my time at Shirley Ryan, so I'm so excited to talk about it with you guys and see your lovely faces. I see a lovely porch in this crowd, which makes me very happy. In terms of my kind of career plans, so I'm planning on applying into palliative care, and I really feel that both the like inpatient medical complexity that I've had the chance to gain exposure to here at Shirley Ryan, as well as my like really deep outpatient experiences, is really like has really given me the good opportunity to set up a foundation for a career in palliative care. So I'm super excited. In terms of kind of one aspect of our program that I really want to highlight, so I think our approach and our value of resident wellness at Shirley Ryan is really special. We kind of approach it from multiple different places. So first of all, I think, the foundation is built in just the fact that we have a really strong community that cares about each other, both kind of residents, attendings, as well as all of our members of our interdisciplinary team are just, very unique and thoughtful people who have come into this field because they care about each other. And so it's really special to be a part of. We also have a dedicated wellness committee, and I will say we really benefit from our ties to Northwestern. We not only have our own Shirley Ryan Residency Wellness Committee, but we also have a larger Northwestern Wellness Committee where we can benefit from both, education and financial wellness, as well as physical activity and just all of these resources that are part of this larger institution that we as residents really get to enjoy. And then kind of my last thought about wellness over in our program is that I do think that the emphasis on having an agency in how we design our residency, we have so much elective time and there's so many different opportunities, as Kara, Chris, and Alice have all mentioned, to really specify our training is a huge part of resident wellness. We're kind of encouraged to define what we want and really spend our time training and building that career we envision instead of going through the same residency program for each of us. And I think that intentionality is a foundation of our wellness too. So it's a great program. Thank you guys for taking the time to listen to us. What questions do you guys have?
So I see a question in the chat, Julia, so I'm just going to jump in and answer it. There was a question about speaking a little bit more about the leadership track. And so, actually it's interesting. One of our program aims is actually develop the future leaders of our field. So as you can kind of gather, we do have a challenging residency program. If you are looking to go into PM&R to kind of have a very easy residency, a little bit of a cakewalk, this is probably not the right residency program for you, to be perfectly blunt. It is, we do have a challenging program. And so naturally, I think we attract people who are really interested in challenging themselves and growing and kind of truly figuring out what their greatest potential can be as a physician. And so pretty much a lot of our graduates and a lot of our residents actually are natural leaders. But then also a lot of them have interest in developing and honing their leadership skills even more. So it is one of our aims to develop the future leaders of our field. And when I say future leaders, I'm not just talking about in academics or in research. It is also really important to develop leaders who are going to go off to places where there is not physiatry that is robust and prominent, and build systems and communities that are underserved from a PM&R standpoint. So that is our goal. So we did develop this leadership track. It's relatively new. It's one of our newer tracks. That our leadership track and our quality improvement track are our newest tracks. All of our tracks within the residency program, the requirement is typically a once a month meeting. There's a little bit of pre-work that you have to do. There's a little bit of a project that's typically tied with things. So, but it's very manageable. It's usually an 18-month cycle that we run these tracks. And so typically our PGY 3 and PGY 4 years participate in the tracks just because it's, we run it every 18 months. I'm really sorry. I think someone keeps on trying. Yeah, there we go. Sorry. So that's the answer to that question.
And then about a 2-minute warning.
Any other questions?
Hi, I have a question. I'm Jackson. I'm a fourth year from PCOM. Thanks for your presentation. You guys have a lot of great energy. That's awesome. I just wanted to ask, within the residency program, what exposure you would have for concussion treatment. Thanks very much.
Anyone else? Anyone want to take that, or I can? Or do you want to do it, Julia?
Sure. So in addition to So our exposure to concussion treatment, I think, is primarily in the outpatient world. We do have a handful of attendings who see concussion treatments regularly. So we've had the chance to be in their clinics and longitudinally follow people after their concussions. And additionally, I think there's a lot of opportunities for being the physician on the sideline in terms of games, and so being present and evaluating people in person. What else do you guys have anything else to add?
So what I was
Krista?
going to say is, concussion is a multidisciplinary management. And so we do actually have vestibular therapists. We do have this multidisciplinary program. We are hiring back. We're really excited. We're hiring back one of our former graduates who went and did her TBI fellowship in New York and is coming back. And one of her big things is to robustly build out our concussion management program. I'll say that our chair does concussion management, and then one of our sports medicine docs does concussion management. But since neither of them are really full-time clinical, it's not this huge program. But Dr. Altanji is starting with us in September, and we're really excited that she's going to bring a more robust program to our program.
Awesome. Thank you guys so much. Sorry, I don't mean to cut you guys off. I just want to make sure we kind of stick with a time limit. So I think we are just about done. You guys have, if applicants have any other questions, oh, perfect. Dr. Lewis has put in the email address in there. Awesome. Thank you guys so much.